So would you say hypnosis is one of the big tools that most integrative medicine doctors and specialists?
I'm glad you're raising that question, because what makes something an integrative tool is not what the treatment is. So for example, when you ask someone, what's a mind-body treatment? They say, oh, acupuncture, or massage, or hypnosis, or herbs, or traditional Chinese medicine.
I would have listed those.
Right. And when I'm teaching clinicians, they'll say, how come you didn't mention surgery? Because the fact is, any treatment can be an integrative treatment, or it can be a mechanistic treatment, depending on your attitude towards it. If someone comes for acupuncture and they're just saying, just stick a needle in my ear so I'll stop smoking, that's really a mechanistic treatment. If someone says, I want to have acupuncture, but I'm going to also look at diet, exercise, emotional stresses, other conditions, how I take care of myself, do I get enough rest, do I have social supports, all of those things, that's more of an integrative use of it, and it's more likely to work better then.
That's very important. I'm glad I was in air there. Stress, I think years ago you and I did a whole show on stress, but what is the latest information that you're hearing and learning about stress, Mark?
Let me start with
let
me start with a definition of it, because that term's used so widely that it almost becomes meaningless.
Yeah.
The definition I like is, stress is the perception that my capacity to cope has been exceeded. So of course that perception is going to be different for different people.
Very individualized definition, therefore.
Yes. When it reaches a certain point, what happens is that the brain secretes certain stress hormones that then impact our adrenal glands and kick out these other types of stress hormones, for example, cortisol, which in the short term mobilize your body to prepare to fight or flee, or to deal with stressful situations, and that's good. In the long term, these same hormones can suppress your immune system, can weaken you, can fatigue you, and make you more susceptible to infection.
So too much being ready to fight or flee
leads to exhaustion.
And
to greater vulnerability to infection.
Okay, so there's a great connection for us there in understanding stress.
It's important to remember that reducing stress is not important only because you're more comfortable. It's more important because it helps increase your resistance to disease.
You know, I think you're right that people have become so used to hearing, and reading articles about reduce your stress that we've become almost immune to being concerned about it.
It almost means nothing.
And yet, stopping and thinking and listening to what you're saying, it's extremely, extremely important.
And as we look at the future,
of
integrative medicine, this is one of the things that they capitalized on, is that we as health clinicians need to get better at educating the public about how important stress is on their physical health and emotional health, and what they can do to change it.
I want to shift gears just for a minute. We only have 3 or 4 minutes left, but you're an expert in the field of pain management. What can you tell us about pain management and integrative medicine that's important to know in 2009?
Sure. That speaks to the difference between acute and chronic pain. If you have an acute pain, meaning a pain that you just got yesterday or this morning or in the past few days, it's much more likely, Mary, that you're going to be able to go into a clinic or an emergency room, get a medication, get a physical therapy intervention, set the leg and put it in a cast, and it's going to help. When the pain becomes chronic, longer than 3 to 6 months in duration, those standard treatments don't work as well. And even if someone's had a herniated disc, in the long term, as a chronic injury, the standard treatments of injections and medications don't work as well. That's where using an integrative approach that looks at medications, stretching, physical therapy, learning to calm the nervous system, learning what factors in your life tend to increase or decrease the pain, all have a much more powerful effect on managing pain. And it's a huge national problem. I think you showed me that article that, what was it?
1 out of 4.
1 out of 4 have a chronic pain problem.
I saw an article saying 1 out of 4 adults in our country have persistent pain.
Right.
And I was surprised, but you were not.
No, and also chronic pain also suppresses the immune system. So when pain isn't managed well, that's another factor that can suppress one's vulnerability to illness. Yeah, especially now with the new viruses that are coming out lately.
Right.
The issue of stress management and keeping your immune system in top shape becomes even more important.
That's another reason to pay attention to it. We want to have you give your website address, and we'll put it up on the screen for you. It's www.drmarkweisberg.com.
Right.
And easy to remember. And if people go to that, they can learn more about contacting you, more about finding articles you've written,
Articles I've
cetera,
written, workshops and presentations I'm
that are
giving,
coming up.
availability for consultation, and other places where I'll be speaking in the upcoming weeks and months.
And you really are, as we said earlier, speaking all around the country, and busy man. When you and Greg get your book written, I'd love to have you come back and talk about that.
Oh, I'd love to.
I'm sure there's going to be some about vitamin D in it that will be fun to learn
count
about.
on it.
Well, thank you for coming down. Thank you for being with us. I've been talking with Dr. Mark Weisberg, who, as you've heard him say, is a clinical health psychologist and very, very much in the movement that is so exciting of integrative medicine. So check into his website. Thanks again, Mark.
Thank you.
See you next week. See you. Bye-bye.